10 common ovarian cancer signs that you should never ignore. Hello friends, welcome back to our channel. Ovarian cancer is often called the silent killer because its early symptoms are easy to miss, but knowing the warning signs can make all the difference. In this video, we're highlighting 10 common signs of ovarian cancer that many people overlook. These symptoms might seem minor at first, but they could be your body's way of signaling something serious. Stay with us to learn the important signs you should never ignore and how to protect your health. 1. Abdominal bloating. Abdominal bloating or swelling is one of the most common signs of ovarian cancer that many women overlook. This symptom occurs when fluid starts to build up in the abdomen, a condition known as ascites, which is often caused by the spread of cancer cells. The bloating can make your stomach feel tight, full, or noticeably larger than usual, similar to how you might feel after eating a large meal. However, the bloating linked to ovarian cancer doesn't go away and may get worse over time, even if you haven't eaten much. Many people initially think it's due to overeating, indigestion, or weight gain, but when the bloating persists and becomes uncomfortable, it's a red flag. This symptom can also be accompanied by a feeling of heaviness in the lower abdomen. Because bloating is a symptom of many less serious conditions, it's often ignored until it becomes severe. However, you should consult a healthcare provider if you experience unexplained and persistent bloating lasting several weeks. Early detection of ovarian cancer can significantly increase the chances of successful treatment, so recognizing and acting on this symptom is essential. Pelvic or abdominal pain that doesn't seem to have a clear cause can be another early warning sign of ovarian cancer. This pain may start off mild, feeling like cramps or discomfort in the lower stomach or pelvic area, but it can become more intense over time. The pain is often persistent and may feel sharp, dull, or achy. However, this pain is different from the temporary cramping some women experience during menstruation. The discomfort linked to ovarian cancer doesn't follow a monthly cycle and tends to worsen as the cancer progresses. This pain is caused by the tumor growing and pressing against organs in the abdomen, as well as by the spread of cancer cells to other tissues. Some women may also experience pain in the lower back or thighs, as the cancer affects nerves and other structures in the pelvic area. Unfortunately, because pelvic or abdominal pain is common in conditions like irritable bowel syndrome, or IBS, or urinary tract infections often referred to as UTIs, it's often misdiagnosed. However, if this pain is new, severe, or lasts more than a few weeks, it's important to seek medical advice. Difficulty eating or feeling full quickly. One of the subtler signs of ovarian cancer is difficulty eating or feeling full quickly after beginning a meal. This symptom occurs because the growing tumor can press against the stomach and intestines, reducing the amount of food you can comfortably eat at one time. You might start a meal feeling hungry, but after just a few bites, you suddenly feel full or even bloated. This sensation can be accompanied by nausea or discomfort. Many women may brush off this symptom, thinking it's due to changes in diet, stress, or even aging. However, if you consistently find yourself eating much less than usual and feeling full very quickly, it's something to pay attention to. This symptom is particularly concerning if it's paired with unintended weight loss. 4. Urgent or frequent urination. Feeling the need to urinate more frequently or urgently than usual can be a sign of ovarian cancer. This happens because a growing tumor in the ovaries can press on the bladder, reducing its capacity and making it feel full more quickly. You might notice that you're going to the bathroom more often during the day and even waking up at night to urinate. Sometimes you may feel an urgent need to go, but then pass only a small amount of urine. While frequent urination can be caused by other, more common issues such as a urinary tract infection or overactive bladder, it's important to consider this symptom in the context of other changes in your body. Women often dismiss this sign, especially if they've had children or are getting older, because these factors can also contribute to urinary changes. 5. Unexplained weight loss. Losing weight without trying can be a warning sign of ovarian cancer, especially when it happens rapidly and without a clear reason. This type of weight loss is often linked to a loss of appetite and feeling full quickly, both of which are common symptoms of ovarian cancer. As the cancer progresses, the body starts using more energy to fight the disease, which can lead to weight loss. Further, the spread of cancer cells can interfere with the way your body processes food, leading to a decrease in fat and muscle mass. Many people may initially welcome weight loss, especially if they've struggled with their weight in the past. Still, it's important to recognize that unexplained weight loss can indicate something serious is happening in your body. You must see a doctor if you're losing weight and can't explain why, especially if it's more than 5% of your body weight in a short period. 6. Fatigue. Fatigue is a common symptom of many illnesses, but when it comes to ovarian cancer, the tiredness can be overwhelming and persistent. This kind of fatigue is more than just feeling tired after a long day. It's a deep exhaustion that doesn't go away with rest. You might need more sleep than usual, yet still wake up feeling drained. Simple tasks that used to be easy, like walking up the stairs or carrying groceries, may suddenly feel like a challenge. This fatigue occurs because the body is using a lot of energy to fight the cancer and cope with the physical and emotional stress of the illness. In addition, ovarian cancer can cause anemia, which is a decrease in red blood cells, and this can also contribute to feeling extremely tired. 7. Back pain. Back pain, particularly in the lower back, can sometimes be a symptom of ovarian cancer. This pain is often persistent and doesn't seem to have an obvious cause, like a recent injury or strain. The discomfort usually occurs because the cancerous tumor is growing and pressing on nerves or other structures in the back or pelvis. In some cases, the pain can also be due to fluid buildup in the abdomen, which puts pressure on the spine. The back pain linked to ovarian cancer may start off mild, but it can become more severe and consistent over time. It's different from the occasional back pain that many experience from poor posture or sitting for too long. 8. Changes in bowel habits. Changes in bowel habits, such as constipation or diarrhea, can sometimes indicate ovarian cancer. These changes occur because the tumor in the pelvis can press against the intestines, disrupting their normal function. You might notice that you're having bowel movements more or less often than usual, or that your stools have become harder or looser than they used to be. Some women experience alternating bouts of constipation and diarrhea. You might feel like your bowels aren't completely empty even after you've gone to the bathroom. While changes in bowel habits can be caused by many other factors such as diet, stress, or irritable bowel syndrome, you must pay attention if these changes are new, persistent, and don't seem to have a clear cause. 9. Menstrual changes. Menstrual changes can be an early sign of ovarian cancer, particularly in women who have not yet gone through menopause. These changes include heavier or lighter periods, irregular cycles, or bleeding between periods. You might notice that your periods have become more painful or that you're experiencing pelvic pain outside of your normal menstrual cycle. Some women may even experience a sudden stop in their periods, which can be particularly concerning if it's unexpected. These changes occur because the cancer is affecting the ovaries, which are responsible for regulating the menstrual cycle. Pain during intercourse, also known as dyspareunia, can be a symptom of ovarian cancer. This pain may be felt deep in the pelvis during sexual activity and can range from mild discomfort to severe pain. The pain occurs because the tumor in the ovaries can press against the organs in the pelvic area, including the vagina and bladder, making intercourse uncomfortable or painful. In some cases, women may also experience pain after intercourse or during a pelvic exam. This symptom is often overlooked or misattributed to other causes, such as vaginal dryness or infection. But it's important to pay attention if the pain is new, persistent, and doesn't seem to have an obvious cause. While many women may experience occasional discomfort during intercourse, persistent pain that doesn't go away should be taken seriously. Recognizing these signs early could be life-saving, so don't brush them off. If you found this information valuable, please give this video a thumbs up and share it with someone who needs to hear this. Early detection is key. For more health tips and life-saving information, hit the subscribe button and turn on notifications so you don't miss our upcoming videos. Stay informed, take care of your health, and we'll see you in the next video.